Depression, causes, symptoms, treatment and prevention. Interesting about science and medicine prepared by editors of a channel All Scientifical. Anyone can experience a deterioration in their mental state due to an unpleasant event in life, but constant depression, a severe form of this mental disorder, is a different matter. Depressive disorder is not an indicator of emotional weakness. This can appear for both physiological and psychological reasons. Most depressive conditions remain undiagnosed and untreated. Often, patients do not tell the doctor about all the existing signs, and because of this, the general practitioner may not diagnose depression. Statistics say that at the moment in the world such things are happening. 5% of all children are in depressive state, 10% of all men are depressed, 25% of women suffer from depression. Depression is the most common mental illness in developed countries. Symptoms of depression. Signs of major depressive disorder. Severe forms of depressive disorder include the following signs: constant sadness, slow speech and movement, thoughts about harming yourself, irritability, nervousness, fatigue, weight change, weight loss or obesity, insomnia or excessive sleepiness, problem with concentration, decreased interest or pleasure in usual activity, feeling of guilt, lack of value, helplessness, pessimism. Symptoms of childhood depression. In children and teenagers, depressive disorder is characterized by the following symptoms: isolation from family and friends, abuse of alcohol, deterioration in school performance, problem with concentration, apathy, weight loss, insomnia, fatigue, headache, abdominal pain, dizziness. Sign of dysthymia. With dysthymia, a chronic but less severe form of depression, the same symptoms are observed but less pronounced. Attention, if you notice an increased impact of some symptom of a disease, consult a psychiatrist or psychopharmacologist. This specialist will help to identify the true problem and help with its elimination. When to see a doctor for depressive disorder? When thinking about harming yourself or other serious signs of depression or dysthymia. Attention, it should be understood that there are significant differences between depression and a bad temporary condition. If you have a temporary black streak, this does not mean that you have depression. Help may be needed if it is impossible to overcome this black streak. Type of depressive disorder. Of course, we can talk about many forms of this disease, but the symptoms we can distinguish three main types: depressive reaction, dysthymia, and severe depression. What is depressive reaction? Depressive reaction is a mild and usually temporary form of depression. It usually occurs as a result of a negative event in the patient's life. The symptoms of this disorder can be very serious, but they go away over time from 2 weeks to 6 months. What is dysthymia? Dysthymia is a more serious form of a disease compared to the depressive reaction. The course of dysthymia can be milder compared to severe forms of a depression, but this disorder is also chronic. What is major? Severe depression. Severe depression, depressive disorder, is a serious illness that can cause disability or other problems. People suffering from this form of depression present very dangerous symptoms. Symptoms of severe depression. People suffering from this form of depression present very dangerous symptoms: helplessness, feeling of guilt, sleep disturbance, insomnia, constant fatigue, lack of interest in usual activity. Such people have a higher risk of losing contact with reality and may also experience hallucination and illusions. Depressive disorder can be cured, but often, due to the fact that it is confused with a depressive reaction, the patient does not receive the necessary attention. Deep depression is considered a cyclical disease. The fact is that many patients, although they recover from the first depressive stage, can return to their previous state due to a very high risk of a relapse. More than 60% in the first 2 years and more 75% in the first 10 years. Severe depression often occurs spontaneously and disappears just as suddenly, often a maximum of 6 to 12 months. Warning: due to the high risk of disability or harm to oneself, a patient with symptoms of severe depressive disorder needs immediate medical attention. This disease can occur at any age, even in childhood. Some studies have shown that in developed countries, about 2% of children and 5% of teenagers suffer from depression. The likelihood of this disease increases with age. In older people, the likelihood of this disorder is higher compared to other category of people. The most common causes of depression are death of loved one, physical limitation associated with age. Elderly widowers have a higher risk of depression. Causes of depressive disorder. This disease can have various causes. Depressive reaction or normal depression often occur as a result of an unpleasant event in the patient's life. There may be other causes for this disorder: viral disease, flu, hormonal change before menstrual cycles of after childbirth, postpartum depression, side effects from drug treatment courses. Causes of dysthymia major depression. Unfortunately, scientists do not yet know the real cause of this form of depression. There is an assumption that this form of the disease may be caused by dysfunction of brain neurotransmitters, for example serotonin, which are responsible for emotion. It has been noted that this disorder has an important genetic component. More than 27% of children suffering from depression have relatives who suffer or have suffered from mental disorders. Diagnosis of depression. Although this disease is very common, in many cases is it either ignored or misdiagnosed. Thus, as you understand, depression is either treated incorrectly or no treatment is attempted at all. Such diagnostic error can cause a patient his life because the likelihood of harming himself increases. Studies have shown that 74% of people who need help with depression seek help from their family doctor, and about 50% of these people are misdiagnosed. "80% of people diagnosed with depressive disorder are prescribed too short a course of treatment. Often such mistakes are made because the doctor is trying to treat a physical symptom, insomnia, fatigue, weight loss, without focusing on the underlying disorder, in this case, depression. Of course, to make a correct diagnosis, it is necessary to exclude some disorder, the body's reaction to certain medication, Graves' disease, deficiency of certain nutrients, vitamins or minerals. In older people, the likelihood of making an incorrect diagnosis increases. This is due to the fact that family doctors associate some symptoms characteristic of depression with aging. They also associate them with senile dementia. Of course, senile dementia is an irreversible disease characterized by loss of memory and concentration, but depression is curable. Because of this mistake, the patient is not prescribed the necessary treatment. For a proper diagnosis and correct treatment, if you suspect any mental disorders, you should contact a psychiatrist or psychopharmacologist. Treatment of depression. There are many types of therapy for the treatment of depression, but classical and alternative. The chosen type of treatment depends on the cause and severity of disease. The most effective classical method of healing depressive states are considered to be electroconvulsive therapy, antidepressant, psychotherapy. How to get out of depression with the help of classical medicine? As a rule, several forms of depression and dysthymia are treated with a combination of antidepressant and psychotherapy. With the help of psychotherapy, the patient learns to eliminate and avoid negative emotion. He gradually returns to his normal activity. The use of drug therapy reduces the effect of neurochemical imbalance that affects the emotional background. Treatment of depression, selective serotonin reuptake inhibitors. The most commonly used drug for depressive disorder are selective serotonin reuptake inhibitors. The most popular drugs in this category are fluoxetine, sertraline, paroxetine. Paroxetine is the most often used to treat depression in adolescents and children. Bupropion can also be prescribed for depressive disorder. Treatment of depression, tricyclic antidepressant. Tricyclic antidepressants have, so to speak, already lived their time. Their history begins in the 1950 when they were introduced to treat depression, although they are still used today. They have many unpleasant side effects, due to which these drugs remain in the background. The most commonly used tricyclic antidepressants are dispramine, doxepin, nortriptyline, amitriptyline, imipramine. Treatment of depression, monoamine oxidase inhibitors. Monoamine oxidase inhibitors are the third category of antidepressant used to treat this disease. These drugs are more effectively than tricyclic antidepressants, but they have more serious side effects and require change in diet. When taking such drugs, there are high probability of developing hypertension if the diet contains food containing tyramine. Some alcoholic beverage, cheese, beans. These drugs are prescribed unless the patient is helped by selective serotonin reuptake inhibitors or tricyclic antidepressant. Treatment of depression, lithium carbonate. Lithium carbonate is a drug used to treat maniac depressive psychosis but can be used to treat depressive disorder. Electroconvulsive therapy for treatment of depression. Electroconvulsive therapy involves delivering an electric shock 80 volts through special electrodes placed on the head. The patient does not feel anything due to anesthesia. Although doctors not yet fully understand the mechanism of electroconvulsive therapy effect on the human body, over more than 20 years of using this treatment method, it has become more advanced. Its effectiveness can be compared with antidepressant, and in some cases it copes better with the disease. Still, doctors recommend using the treatment method only if other treatment method fails. The fact is that electroconvulsive therapy required hospitalization and general anesthesia. This type of therapy is also used to the patient has attempted to harm himself or refused to eat and drink. Typically, electroconvulsive therapy includes 3 sessions per week for 2 weeks, not exciting 10 sessions during this period. How to get rid of depression using alternative medicine. Various types of alternative medicine can be useful for minor depression. However, for more serious form of disease, it is recommended to stick to classical type of treatment. Attention for the treatment of complex or chronic form of depressive disorder, the help of a psychiatrist is necessary. In addition to classical methods of treating depression, acupressure or acupuncture are often prescribed. This technique eliminates some symptoms, but for this you should only contact a highly qualified specialist. Massage relaxes the body, which is very useful in treating this disorder. Treatment of depression, essential oils. Aromatherapy can help relieve fatigue and improve sleep quality. The best source of essential oils that help with depression are chamomile, rose, jasmine, St. John's wort, basil. Any of these essential oil can be used as follows: 1-2 drops on the edge of a pillow, 5-6 drops on the bed, 2-3 drops in a container with hot water. Treatment of depression, biofeedback. There are studies proving that biofeedback can effectively reduce the intensity of all types of depressive disorder. This type of therapy creates an effect on the brain similar to the effect of taking antidepressant. The number of feedback sessions depends on the severity of the disease. Depressive reaction up to 6 sessions, dysthymia up to 20 sessions, severe depression 30-16 sessions. The advantage of this type of treatment is that the patient can use it whenever want with the help of self-hypnosis. Treatment of depression, physical exercise. Physical exercise should accompany any type of treatment for depression. Their most important positive effects are considered to be stress reduction, improvement of emotional background, improvement of blood circulation and brain. Great success have been noted the treatment of depressive disorder using sports. In some cases, the effect of physical exercise could be compared to psychotherapy. To do this, choose physical exercise that you like and do them daily. Any physical exercise can be useful. Treatment of depression, phytotherapy. Depending on the severity of a signs of a depressive disorder, the doctor may recommend various herbal mixture. A good example of this is the following collection of medicinal plants used to prepare the tincture: St. John's wort, common wormwood, narrow-leaved lavender, sawn wax straw. St. John's wort in any of its forms is considered a very good remedy for depression, but it all depends on the patient. In some cases it helps, but in others it may not. The treatment of depression, psychosomatic medicine. Many psychosomatic methods can help with depression. Dancing and music can replenish energy and improve morale. Meditation and various relaxation techniques will help overcome depression. Yoga, Tai Chi, Kick Song also have a beneficial effect. Diet for depressive disorder. Because certain food can exacerbate symptoms of depression, patients with this disorder need to follow a certain diet. The main category of food recommended for depressive disorder are low-fat dairy products, fish, vegetables, fruit, low-fat meat, cereals. The following foods should be excluded from the diet: caffeine, aspartame, sugar, unhealthy food, alcoholic drinks. The following vitamins and minerals have been noted to have a positive effect on the patient's condition. Selenium, 100 micrograms per day, have a positive effect on improving mood in areas where there is a deficiency of this microelement in foods. As adenosyl methionine, 800 micrograms 2 times a day. Folic acid, 400 micrograms per day. Some Western scientists have noticed that adding L-tryptophan to the diet improves the symptoms of a depression. The fact is that L-tryptophan is involved in the synthesis of serotonin. Tryptophan is found in the following foods: soy, peanut butter, breast yeast, peas, beans, fish, chicken, Turkey. For the better absorption of tryptophan, it is recommended to consume large amount of carbohydrates, potatoes, rice, pasta. Prevention of depressive disorder. Unfortunately, some form of depressive disorder cannot be prevented. This is due to the fact that this disease can appear as a result of improper neurochemical function of the brain. Still, there are studies showing that a healthy lifestyle can prevent or reduce the symptoms of this disease. In order to prevent the occurrence of depressive states, sadness, it is recommended to introduce the following rules into your lifestyle: relaxation, physical exercise, proper nutrition. Thank you for your attention. This material was prepared by editors of a page of Scientific Attention. This material is for informational purposes only. When observing very unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.